Hi, how are you? Welcome to another videos for MRCS exam. Here the question: through which of the structures listed below does the axillary nerve pass? So from the question, it is one of the short question, and we can see through which of the structure listed below does axillary nerve pass. So axillary nerve pass in the which of the following spaces or following structures. So we have to find out one of the space or one of the structures through which the axillary nerve passes. So here are the options. The options are quadriangular space, triangular space, quadriangular space, and triangular space. They are present in the back of the shoulder, and the subclavicular abscess space it present below the clavicle. Subpectoral space, this lies in the pectoral region or chest region, anterior chest region. Intercostal spaces, that means the space between the two intercostal two ribs. So we have to find out one of the options through which the axillary nerve pass, and we know that the axillary nerve is supplies the deltoid muscle, so it usually presents in the shoulder region. So we have to find out the spaces which lies along the shoulder level. So first of all, we can see in the back of the shoulder there are some spaces here. First of all, here we can see this is a quadriangular space, and here we can see this is a triangular space, and this triangular space is known as the lower triangular space. And here we can see upper triangular space, it is another triangular space. So these spaces boundary are also very important. First of all, let's see the quadriangular space. So first of all, in the above quadriangular space, it is bounded by the teres minor, and below it is by the teres major. So we can see in the almost all of the time, usually the minor lies in the above and major below. So here you can see the major teres major, here also this lies below, and teres minor it lies above. So teres major and teres minor, it's from the inferior and superior border or inferior and superior boundary of the quadriangular space. Then we can see this is the lateral part. Is this lateral part is formed by the humerus, and the medial part it is formed by the, here it is the long head of triceps. So here we can see the quadriangular space, it's bounded superiorly by the teres minor, because major always below and minor above. And lower boundary it is formed by the teres major. Medially it is formed by the long head of the triceps, and laterally it is formed by the humerus. And we can see if we go down the lower triangular space, because the quadriangular space and lower triangular space, they are the most important, and the boundary of it should be read very clearly. So here we can see the superiorly it is bounded by this muscle, and this is teres major muscle, and the medial boundary it is bounded by the long head of the triceps, and laterally by the humerus. So in both cases we can see there is that the both medial and lateral boundary are the same. Medial boundary it is bounded by the teres, bounded by the long head of triceps, and laterally it is formed by the shaft of the humerus. And in case of triangular space, in upper part it is formed by the lower border of the teres major muscle, and in the lower part at the junction of the long head of triceps and the humerus. So this is in short the boundary of quadriangular space and triangular space. So these two spaces are very important, and here we can see the upper triangular space. It is usually not important for the exam, but for interest it should be read. So above part, the minor is always lies above. Then lower part it is formed by the teres major, and lateral part it is formed by the long head of the triceps. So let's see the structure which passes the, here we can see this is the another picture to remember. Here we can see the minor always above, then in the lower part this is major, and the triceps, long head of triceps and humerus, they present in case of quadriangular and triangular spaces, and triceps always form the medial boundary in two spaces, and humerus form the lateral boundary. And above part for quadriangular space it is teres minor, and for quadrangular triangular space, it is teres major. So here we can see this is the space, this is the quadrangular space, and here this is the triangular space, and we can see there is the boundary again, and here the structure passes. Here we can see a nerve and a artery passes through this quadrangular space, and if we see this name, this nerve is the axillary nerve. So axillary nerve, it passes through the quadrangular space in the back of the shoulder and with another vessels, and this vessel name is posterior circumflex humeral artery. So in quadrangular space there are two important structure passes. One is the axillary nerve and another one is the posterior circumflex humeral artery. So these two content is very important, and it will have to be remembered all the time for exam. And here we can see the lower triangular space, and it is lower triangular space, it is bounded medially by the triceps, laterally by the humerus. It is the fixed boundary of two spaces, and above part it is formed by the lower border of the teres major. And here we can see here also two important structure passes there. One is a radial nerve, which is the extensor nerve of the upper limb, and this radial nerve, it supplies the almost all of the extensor muscle of the arm, forearm and hand. And here we can see the profunda brachii vessels. So in the lower triangular space there is two content, one is radial nerve and another one is profunda brachii vessels. So here we can see the upper quadrangular and lower triangular, they both contain two structure. In the above part, axillary nerve, posterior circumflex humeral artery, and in the lower triangular it contains the profunda brachii vessels and radial nerve. And we can see this is the upper triangular space. Usually it is not much more important for MRCS exam, but we can see here this circumflex humeral artery present here. So here we also can see another picture, same here, this is the teres minor, and below here the teres major muscle, and between the two major there is the quadrangular space. So quadrangular space, it lies between the two major and fixed two boundary. One is lateral, another on is medial by the long head of triceps and lateral by the shaft of the humerus. And here we can see there is the axillary nerve, and its axillary nerve supplies the deltoid muscle, which causes abduction of the shoulder. And in the lower triangular space there is a nerve, this nerve supplies all muscles of the extensor group of the upper limb, and the vessel, which is profunda brachii artery. So our final answer is quadrangular space. The axillary nerve, it passes through the quadrangular space. The quadrangular space, axillary nerve, it passes through quadrangular space with another vessel, and this vessel is posterior circumflex humeral artery. And lower triangular space, in the lower part, it contains also two structures, that is the radial nerve and the profunda brachii artery. And other structures such as subclavicular space, subpectoral space and intercostal space, they are not related to this area, that means in the shoulder area. So our final answer is quadrangular space through which axillary nerve passes.